In this video, we're going to talk about evaluations, and specifically evaluations in the school-based setting. Evaluations happen in the school-based setting after a student is referred to the special education team and the parents consent to evaluations. So typically concerns arise with a kiddo, and those concerns can include gross motor concerns as well. Maybe they're tripping and falling a lot, having difficulty with stairs, need a teacher to hold their hand when they're going up and down the risers, having a hard time sitting at circle time, struggle to get up off the floor, need assistance on the playground, things like this. The teaching staff will inform the special education team, and that referral process will get started. The team may meet and try to put some interventions in place, either using the MTSS, the multi-tiered support system structure, or something different. Really just depends on the school district and kind of what their process is. And then after they have taken data and realized that has not gotten the results they were looking for, the referral process will begin, and the parents will give consent to the different specialists they would like to have evaluate their child, and they will agree to those specific areas of the evaluation. And if those boxes are not checked, then those areas cannot be evaluated. We must have consent for every single area that is to be evaluated in advance. And parents can say, no, I do not want my child to be evaluated for special education services at all. So this video is specifically going to be about school-based interventions. There's also the medical model, which is outpatient orthopedics, but we're not talking about that in this video. Once a kiddo is going to be evaluated by a physical therapist, the standard process is that you first want to know if physical therapy is a related service or an SDI service, or both in your state. Typically, physical therapy is going to be mostly related service. I know Washington State, it can be either. So Washington State, it can be related service or SDI, but most of the time it's related service. We're going to speak mostly about related service, and then I'll kind of show you where that SDI component will potentially come into play later on. There's kind of two routes you can take in order to do an evaluation for a kiddo in the school-based setting. You can do a functional evaluation, you could do a standardized test, and actually the third one is you could be pulled into a specific group test that could be kind of standardized or not. This is mostly for pre-K. You can then, in this group test setting, do your own functional eval, your own standardized test, or you could do a group standardized test like the Transdisciplinary Play Based Assessment version 2. So the TPBA2 is actually a standardized test where it has kind of three areas. There's really kind of that fine motor object manipulation area, the educational or cognitive area, and then the gross motor area. And then all three disciplines are represented. Each section kind of gets its own standardized score with an SD, with a standard deviation. And so those are norm-based reference tests, which essentially gives you the percentage on a bell curve of where a kiddo is based on their typically developing peers. So this is the one that I see the most as far as like a group-based test. And that's typically when a kiddo goes from 3-year-old, they age out of early intervention, or they're found through child find, and they go to determine if they would require special education services and then therefore be eligible for developmental preschools in the public education sector. In the school-based setting, there are some standardized tests that I do think are relevant. This is kind of my professional opinion. Other therapists will have different opinions. I personally really like the school functional assessment. This is a criterion-based test, which essentially means that you take the score the child has And then you're able to compare that score to their future self or their past self. So essentially, if you do it when they're like in first grade or kindergarten, and then you take it 3 years later when they're in fourth grade or fifth grade, third grade, fourth grade, you'll be able to take that third grade, fourth grade assessment and compare it to their level of independence when they were in kindergarten and first grade. These are really great for kiddos that have significant impairments but are really functional in the school environment. So say the kiddo is in a power wheelchair or they're in a manual wheelchair and they do need some level of assistance, but for the most part, they're really functional and really independent. This is a great way to show parents and other educators like, hey, this kiddo doesn't need the expertise of a physical therapist necessarily right now or in most of these areas because they're able to do all of it independently or with some modifications. And what I really love about the school functional assessment is that it has both adaptations and levels of assistance. So an adaptation, if they're independent with adaptations, they have an independent score, and then they also have a score for like how much adaptations do they need or how much assistance do they need. And it also covers a lot of different areas. You can do the gross motor only section, which is about kind of moving in the school environment, opening and closing doors, getting up off the ground, walking. There's a playground / PE section, there's a handling materials section, there's a toileting section, there's a stairs section, and there's also a fine motor section as well as cognitive and also a safety section. So I really feel like from a school-based therapist perspective, especially if you have those kiddos where their parents really feel like they should be getting the most PT ever, but the child themselves are actually really functional. This can be a tool that you can utilize to say, hey, they're actually really independent in the school environment. And the more time I spend with them, the more I'm pulling away from these other areas of concern like reading, writing, and math that you've also notified and understood and agreed to being kind of really priority areas. So we can't have everything. We really want to stick to that child's least restrictive environment. So that's probably like my favorite standardized test. Other standardized tests that I have considered utilizing and have utilized in the past, the test of gross motor development, second edition, the TGMD2. I really like this test because it's very well rounded. It uses object manipulation, a lot of cross body movement like hitting a ball with a tee. It really breaks down the movement patterns into partial tasks. So it brings it down to like the initiation of the movement, the execution of the movement, the termination of the movement, and some quality as well. And it's also a lot of just generalized gross motor activities that a kiddo would need to kind of be active and play with their typically developing peers. And so I really like this test because it's quick and easy. It does require some equipment to be purchased, such as a bat, a tee, and a ball, I think are the biggest ones. Everything else like a playground ball and a tennis ball are fairly easy to have lying around if you're a PT. But the TGMD2 is a norm reference test, so you are going to get a standardized deviation for this test. And that can be helpful if you are utilizing this test for a kiddo who is kind of on the fence, but you really feel like and can see the educational impact. And especially if they're in that developmental delay category, they're under 8 or 9, depending on what state you're in, and you need that second area of negative 1.5 standard deviation. I've also utilized this test as a way to give parents some concrete information that, hey, your kiddo is functional in the school environment and their score is so high that we can confidently say they no longer need school-based physical therapy services. Because on the flip side, a lot of times parents will really want to hold on to you as a therapist and the kind of just in case model. And that's not always what's best for the child. And it's not always healthy, but it can be really scary for parents. And so sometimes having a standardized test with kind of that hard concrete evidence can be really helpful. I also really like the TGMD2 because it's not often replicated in outpatient ortho clinics. A lot of times outpatient ortho clinics are going to use the Brunix, the BOT, or the Peabody. And so I don't love using these tests in a school-based setting because if the kiddo also receives outpatient orthopedics, they are going to likely be getting this test every 6 months to 1 year. And sometimes if you have a kiddo take a test too many times, you're not necessarily getting the full picture of the kiddo, and you could also be potentially messing up the result of the kiddo's outpatient ortho tests if you give it to them and then they take it again in 2 or 3 months. It's essentially kind of practicing to the test, which is not ideal either. On the flip side, the other option that you can always do as a school-based physical therapist is do a functional evaluation. So you don't actually have to do standardized tests at all. And a lot of times I really choose to go the functional evaluation route simply because I find it to be the most full picture of what the child is doing in their current environment. And I'm able to really describe their specific movement patterns as they are happening and delve deep into those impairments and why in a functional evaluation, as opposed to me utilizing a standardized test, which gives me an already curated list of things to do. For a functional evaluation, though, areas that I'm going to look at are kind of floor mobility, especially if they are a lower level kiddo. If they are rolling and they're not able to sit unsupported, then I'm going to look at supported sitting, rolling, prone, some more of those kind of infant typical gross motor milestones, even if the kiddo is 6. Like I'm going to look at their gross motor milestones no matter what age they are based on the level that they're at. Are they able to crawl? Crawling is an independent means of mobility and really important. If a kiddo is progressing towards quadruped and they're 8, we're going to work on crawling because that means they can get from point A to point B and can start utilizing that cross-body system and get to what they want. And when they start to be able to get to what they want, they don't have to rely on everybody else. Different styles of choice will start to come out more naturally. So I'm going to look at floor mobility. I'm going to look at transitions. So this is how they get from one place to another. So from the floor to standing and then back, because they are different qualities of movement. So going from the floor to standing, what are they doing with their arms? What are they doing with their legs? What impairments do I see there? When they go from standing to sitting, how is that quality of movement? Chair to standing and back when you're from a more elevated standpoint, but the chair specifically too, even though it's an easier sit to stand, like the chair might move on them, which is an added balance challenge. Posture in standing and sitting. So when they're sitting, are they able to maintain a crisscross applesauce position or a tailor sit position? What does their posture look like? Are they able to maintain it for 1 minute? Are they able to maintain it for 5 minutes? Are they able to sit in a desk appropriately? Things like that. I'm going to look at stairs. I'm going to look at going up and down. The level of assistance do they need? Which is there a movement pattern? Is one foot leading going down and the other leading going up? Or is it flip-flops? Are they using the handrail? Are they not using the handrail? I'm also going to ask about kind of toileting. I'm going to talk to the PE teacher. I'm going to try to get them out on the playground. I'm going to have them open and close doors. I'm going to ask about lunch. Do they need assistance throwing away their lunch tray? Are they able to walk in line with their peers? Again, kind of walking in line in general. So I'm going to look at all of these different areas, and I might not get to every single one of them, but I'm going to try to paint the best picture that I can. And before I go into the evaluation, I'm going to talk to the teacher either in person or via email and get their concerns and kind of hone in on those first. So if I have a limited amount of time, I'm getting kind of the most bang for my buck because these are already areas that have possibly known impairments. And I'm going to also look for, are these impairments within the gross motor scope of practice / PT area, or are they more due to other areas? So for example, sometimes sensory / OT areas can have a bigger bang for their buck if the kiddo is more squirrely, can't sit still, things like that. The OT might be a better person to work with the kiddo than the PT, although the PT might be beneficial for some of those gross motor things, maybe on a collaborative / indirect therapy style. These are kind of all the areas I'm going to look at for a functional evaluation. And then I'm also going to do kind of a summary. And if I feel as though maybe there's some orthopedic concerns, but it's not showing an educationally relevant impairment. It's not really impacting their actual experience in the school and in accessing their education. I'm going to do a recommendation section, and I'm going to kind of write out what I see and why that's maybe more of the medical model of PT, and almost write like a referral to outpatient orthopedics without it saying that I am referring to outpatient orthopedics, because legally in a school-based setting, a lot of districts won't want you to essentially refer to outside therapies, because then the parents may come back and sue them and say, well, you recommended this. And so now you have to pay for it. So a lot of times I'll use language that is more general, like talk to your physician about these concerns. These are the areas and the styles of providers that may be able to, help you further. Feel free to bring this documentation with you, because technically, so in this recommendation section, it's really more restating that the child will or will not benefit from school-based services, and whether or not they demonstrate a need for school-based services. So a lot of times in the recommendation section, I'll write things like, Joey does not demonstrate a need for school-based therapy at this time. However, it is noted that he shows impairments in his limitation in dorsiflexion. It may be beneficial for him and his family to speak about these concerns with his primary pediatrician. And then candidly, in the meeting, a lot of times I will bring up these impairments are typically treated out in town by an outpatient orthopedic physical therapist or a pediatric physical therapist. However, I cannot recommend that you go see a pediatric physical therapist. I'm, really limited in my ability to refer you to any outside services. However, I do want you to know and to educate you that these services are available should you choose to utilize them, and that these impairments typically would be treated by these types of individuals. I hope you guys found this really helpful. I super appreciate you finding this video, and I want to make sure that you subscribe so that others on YouTube land can find this video, and also so we can help kiddos benefit. When we have more knowledge, we are better able to serve them, and that is the end goal. Make sure you like this video, and again, please subscribe. It absolutely means the world to us. Take care.